Hello, this is Dr. Tall Paul Simon, psychiatrist, talking to you from my home office here. Today, I wanted to talk to you about the influence of drug companies on psychiatry. But before I get into that, please subscribe and like this channel to get more insider tips and information on psychiatry and mental health in the real world. So, I get a lot of questions from people just in casual social situations asking me about the influence of drug companies on the field of psychiatry. Well, I take it back. I don't get a whole lot of questions about that, but I think about it a lot because I care about it a lot. And they do have a lot of influence on the field of mental health and medicine in general. So, a lot of what I'm talking about doesn't just apply to mental health and psychiatry, but medicine in the broader sense of the word. So, drug companies, in my opinion, are a very mixed bag, okay? But they have done a lot of good, considering all the amazing medications that they've come up with as far as vaccines, the cure for polio and measles and all these kind of different things. I am not an anti-vaxxer by any stretch, but I think a healthy dose of skepticism is warranted. I always encourage people to follow the money whenever they think about these different companies and their influence on medicine and anything in general. I think it's a good principle to remember is follow the money. Now, with Big Pharma, they make a product and they want to sell it, right? So in medicine, how do they do that? First, they have to prove to some degree that their product fixes an identified problem. So basically, for instance, they want to find a solution for a problem and then sell it, which makes sense. I think anybody who's in business tries to fix problems for people and get paid. Now, with medicine, it's a bit different, especially in psychiatry, because a lot of what we do while attempting to define different mental illnesses as objectively as possible, there is some subjectivity to it. For instance, if somebody says that they're depressed and you can't see it, they're not crying, for instance, or not obviously trying to hurt themselves, trying to commit suicide or something, it's somewhat difficult sometimes to see if somebody is suffering from depression. Now, there are a lot of other conditions like ADHD or bipolar or other things that can also be subjective when it comes down to it in the diagnosis. So the subjectivity can be manipulated. There's some wiggle room where the drug companies will try to convince people and clinicians, patients and clinicians, just people in general, that they have a condition that they may or may not have. And you can see this to some degree with the recent dramatic upswing in the diagnosis and treatment of ADHD since COVID. I get a lot of people coming to me who think they have ADHD because maybe they took a screening test online or talked to somebody or saw an ad or commercial or talked to somebody who had taken a particular medicine and they want to get evaluated for ADHD, but it turns out that they have some anxiety issues or sleep trouble or depression or a myriad of other issues contributing to their focus or attention problems. So a lot of times that subjective interpretation of what's actually going on can be pushed a certain way or influenced by these drug companies through advertising or social media pushes. Now, one example of a phenomenon or an instance that made me really start to consider the influence of drug companies on mental health and psychiatry was when I was really first getting started in psychiatry in the late 2000s, like around 2009 or so, when I was finishing up my residency at Washington University, where a lot of research in all these different fields of medicine occurs. It's a great research institution and they do a lot of amazing things. But they get a lot of money from different drug companies to do their clinical research. Now, what I found, and this is my subjective interpretation of the situation, is that over the 90s and the 2000s, the definition of bipolar disorder was broadened. Okay, so the criteria, the official criteria for bipolar were loosened to catch more instances of bipolar. And that may be a good thing for a lot of people because you're getting their situation treated. But if you're labeling somebody who has labeling somebody as having bipolar when in fact maybe they have something else, such as anxiety or borderline personality disorder or something that has anger or mood swings with it, you get them labeled as bipolar, and you happen to be the person who's doing research on bipolar, there's a secondary gain there. For example, let's say a researcher is doing research on bipolar, and they happen to believe that the definition of bipolar needs to be broadened to capture more people and more people with their condition. A drug company who's selling bipolar medication is going to come in and say, okay, yeah, that's brilliant. We think we should have more money to continue your research in broadening the definition of bipolar. So in effect, they're funding the researcher to promote a wider net of diagnosis for those conditions for which they make money for treating. So in the early 2000s, around the time there was a lot of very expensive bipolar medications coming out, and the definition of bipolar was being broadened and broadened and broadened to the point where it almost lost meaning in the popular culture. Anybody with mood swings or anger, all of a sudden, oh, they're bipolar. When you really get down to it and really hold to the formal criteria that have been used for a long time, they may or may not in fact have bipolar. So the drug companies were basically funding these research chairs and different things in different places, or researchers, to broaden the definition of the condition so there'd be a bigger market for their product. A lot of money be made. And I've seen that occur a number of times over the years since then, with, like I said, the diagnosis of ADHD, but also the diagnosis of like serotonin syndrome or tardive dyskinesia, different conditions relating to mental health that have been popularized and advertised when a new product comes out. So whenever I see a new set of medications that comes out, may or may not be a good medication, in my opinion, but I'll see a wave of interest and diagnosis for that condition. And that's due to the advertising push that the drug companies will make. Now, I remember when I went to a conference for the American Psychiatric Association years ago in San Francisco, there were some protesters, and they were from the Church of Scientology, and they are very anti-psychiatry. They don't believe in mental illness. They believe in a lot of very strange things. And I remember seeing a banner that said, "Psychiatrists get paid to drug kids." And I thought it was very ridiculous because I am not aware of any financial incentive to drug kids that I've ever come across. Now, granted, I finished my residency in 2009. Now, 20, 30 years ago, I think that medications and drug companies, they did give kickbacks to physicians years ago if they used their medications. But that does not occur anymore at all. That's very illegal. And a physician that does that would go to prison. So there's no kickbacks or anything like that from drug companies going to any physicians. Now, the caveat to that is, there is an indirect way that a physician can get medication from a drug company for promoting their product. And how that is done is through funding clinical research and funding speakerships. So a physician, for instance, who prescribes a certain very high dollar branded medication may be asked by the drug company to promote their medication. Now, maybe not directly, but give a talk over dinner in a fancy restaurant and get paid $1,000 for a half an hour to an hour talk, by which they are in effect promoting a particular medication and providing a venue for drug company representatives to interact with the attendees, being other physicians and clinicians. So basically, while the physician or psychiatrist may get a speakership fee, a high dollar speakership fee for just giving a talk, which includes PowerPoint slides and a presentation that is designed and handed to the physician by the drug company. They may not get a direct kickback, but in effect they do. So a lot of these drug speakers, these physicians who speak for Medscape, or give talks on the radio, or give interviews on the TV, a lot of them funded by the drug companies to go out and mention the drug company's medications. So they are biased in that way. So whenever I see some world-renowned expert on TV or giving an article, I always have to wonder, okay, who's funding them? Why are they so eager to get in front of a camera or anything? Now, I do not receive any money from drug companies indirectly, or speakerships or anything like that. I've made it a point to not interact with drug representatives at all. Early in my career, I would allow drug reps to come in and provide lunch for the staff just because it was nice for the staff. But then I'd have to interact with the drug reps, and they're salesmen, they're saleswomen, they're salespeople, and they are trying to convince me that their product's the best, and throw a bunch of smoke in my face about that, and I really didn't enjoy that. So after a few years of that early in my career, I decided to give that up, and the food just wasn't good enough for that. So I can honestly say that I do not indirectly or directly receive any support from drug companies. Now, another way that drug companies will influence your physician is through free samples. Okay, so let's say you have high blood pressure or depression or whatever, and the doctor recommends a new medication that works differently, and it's all shiny and new, and it just came out, and they're saying, well, we can give you free samples of this medication. I always, there's some suspicion there, because while they're providing you the medication free, they are starting you on a very expensive medication. And those free samples are provided by the drug company. They're provided by the drug rep from the drug company. So what I see happen is people will get started on a very expensive medication, and then the drug rep or the drug company stops giving the free samples. What then? They have to pay for the very, very expensive new medication that may or may not be approved by their insurance, and they're stuck. So that's how a lot of these drug companies and drug reps will get you started on a very expensive medication by making it free to begin with, an introductory offer, okay, but then have you on the hook for the medication. Now, it doesn't mean you're hooked per se, like, a drug addict in that way, but you're stuck because they gave you very expensive medication. And what do? Maybe it's working and it's a good medicine, but you're on the hook for thousands of dollars a month. Whereas there may be perfectly effective, much cheaper generic alternatives. That is the reason why I do not have medication samples. I don't provide medication samples to my patients because I think it's disingenuous, and it distracts me from more viable and reasonable alternatives for the treatment of the patient. So I'm not a big fan of drug samples. And drug companies will broaden the definition of a particular illness to provide more market for their product. While direct subsidies to doctors for the actual prescribing of the medication, as in kickbacks, is illegal, they do find ways to influence and steer us in particular directions. So that is my summary for how drug companies influence psychiatrists and other physicians. Keep your guard up, follow the money. Always ask if there is a cheaper generic alternative, because that's a more long-term financially viable option. May not be the best. You may have to go with the more expensive one, but always follow the money. All right. You guys take care, and we'll talk again soon. Bye-bye.